For Sierra Leone, we are committed to ensure that there is zero preventable maternal death, zero preventable child death. We've had tremendous gains in reducing maternal mortality by over 60% over the past few years. But you cannot do everything you can to reduce maternal mortality to such a degree and do everything you can for the mother's health and the baby to arrive safely, and then you end up losing the baby before age 5. So what we want to do is to focus on maternal mortality on the one hand, but also focus on child survival. So we were fortunate that when we went to the RC 74, I was able to raise this with my colleague ministers of health throughout the continent for us to have a determined focus on child survival by declaring child health an African continent-wide emergency that we'll focus on. We're not only looking at basic obstetric care, we're looking at comprehensive obstetric care as well, expanding services that are able to do C-sections, that are able to do everything we can to allow for the safe arrival of the child. Once this child is here, what we're doing now is focusing on what are the key components of our activities to let this child not just survive, but let the child thrive. So we have deliberate efforts following the life stages approach, from pregnancy to the baby, to school age, to young adults, to senior citizens. The government of Sierra Leone sets a clear vision. The Ministry of Health sets a clear vision for where we want to go. And we've had a very active engagement with our partners, and especially WHO and UNICEF and all of the UN agencies and our bilateral and multilateral partners. And we're looking for the development partners to accompany us on the vision.